Hey everybody, Andrew Wolfe at the Center for Cosmetic Surgery with an important safety bulletin. So, the topic of this PSA is anesthetic and surgical safety in patients who are taking Ozempic, which is a medication, the generic of which is semaglutide. So you've got Ozempic, there is another drug called Wegovy, there is a related class of medications that's called terzepatide, which is Mounjaro. And so this is a couple of different drugs that initially were used to treat diabetes. They were found to have an additional property of decreasing appetite in patients. And so they are now being prescribed in a very significant number of patients for weight reduction, weight loss. The mechanism of action for these drugs is that they slow the emptying of your stomach, so it's decreased gastric emptying, and you stay full longer, you eat less, you lose weight, right? That mechanism is pretty straightforward. The challenge arises in patients who are having general anesthesia. And as some of you know, we have our own surgery center here on site, fully accredited facility, our anesthesiologists, our nurses, it's all very well controlled, but we are very safety conscious. And the concern was brought to us by the anesthetic group that they are seeing both clinically and in terms of recommendations from the American Society of Anesthesiologists that the normal limitations in terms of eating prior to surgery, how long do you have to be without food before you're safe to put to sleep with anesthesia, that time that we typically see, which is 8 to 12 hours, is not sufficient in a lot of patients who are taking these medications that slow gastric emptying. And the risk is, if your stomach is still full when you're having general anesthesia, there's a risk of the stomach contents coming back up into your airway, and it can be very dangerous. And so we are, as of now, pushing the time that patients must be off these drugs for 2 weeks based on current recommendations, meaning the patient needs to, it's a once a week injection, and so these patients need to be a couple weeks without this drug before they're considered safe to have general anesthesia. And so that's what we're putting out there for our patients. It's something where if you're somebody who's not a patient of ours, but you're considering having surgery somewhere, you should probably bring this up with potentially your surgeon, certainly your anesthesiologist, because your safety is important to us. It should be important to you. This is one of those drugs that is new on the market, and so we are just figuring out how it interferes or affects surgery and the safety surrounding it. So as we learn more, we will keep you informed. In the meantime, stay safe. Reach out if you have any questions. Always delighted. Thank you.